All right. Hello, and welcome to the fourth episode of our series highlighting current and exciting research projects in the MGNet Research Consortium. My name is Anusha. I'm a project manager at MGNet, and I will be your host for today. I am joined by Dr. Gianvito Masi, a researcher at Yale University School of Medicine. He was selected as the 2022 MGNet Scholar. I am also joined by Ms. Meredith O'Connor, Assistant Vice President of Patient Engagement, Advocacy and Policy at the MGFA, who also happens to be living with MG. In this episode, we will feature Dr. Masi's project titled Investigating Immune Mechanisms Underlying Checkpoint Inhibitor Myasthenia Gravis. I now will give you both the floor to discuss this important topic in MG research.
Great. Thanks, Anosha. Dr. Masi, thanks so much for taking the time to chat with me a little bit about your research. I'm really excited to learn a little bit about it and keep patients informed. So talk to me a little bit about the research that you're doing. What is the research about?
Thank you. So my research is about a novel complication of cancer therapy known as immune checkpoint inhibitor-induced myasthenia gravis. So in order to give you a brief summary of my research, I'd like to start by explaining what checkpoint inhibitors are. So in the last 10 years, there's been tremendous progress in cancer research and novel treatments have been approved. Now, among these treatments are immune checkpoint inhibitors or ICIs. So these are a group of drugs that act in a similar way. They can boost or activate our immune system to fight against cancer. Now, these treatments have been approved for many types of cancers, including melanoma, kidney cancer, and lung cancer, and they're quite effective. In fact, they can extend the life of patients with cancer from months to years. Now, despite being quite effective, these treatments can also cause side effects. Neurologic complications are quite rare among 1–2% of patients receiving immune checkpoint inhibitors, but they can be severe. In some cases, these complications can affect the brain, but in most cases, they affect the nerves or the muscles. And now we've been noticing an increasing number of patients diagnosed with myasthenia gravis following immune checkpoint inhibitor therapy. And now we wanted to understand more about this disease. So we know that these patients can develop muscle weakness following this treatment, and acetylcholine receptor antibodies are found in a subset of these patients. So the main question of my research was to compare immune checkpoint inhibitor-induced myasthenia gravis and classic myasthenia gravis to understand similarities and differences between the two conditions.
Wow, that's super interesting, Dr. Masi. I think, as I was mentioning to you earlier, in the 20 years of living with this disease, I didn't know that that was even possible, let alone not prevalent, but that it exists. So that's really important research. Speaking of importance, why do you feel it's so important to compare the two, or to at least have a basic understanding of the similarities and differences?
Right. So we know from a clinical perspective, the two diseases are quite similar. In both cases, patients present with muscle weakness. However, in patients with immune checkpoint inhibitor myasthenia gravis, we notice that there's a more widespread inflammation of the muscles, and in some cases, patients can have heart problems. So we wanted to look at their immune system, and so for this reason, we decided to start from the antibodies. So we know that in classic myasthenia gravis, the antibodies are directly responsible for symptoms. In most cases, the antibodies bind to the acetylcholine receptor. And so we wanted to study the antibodies in the two conditions. So long story short, after a series of experiments, we found that while in classic myasthenia gravis, these antibodies were able to induce muscle weakness, well, in immune checkpoint inhibitor myasthenia gravis, these antibodies were present, but they were silent, suggesting in reality that other factors could contribute to muscle weakness in these patients. And this is very important because studying the mechanism of the disease can lead to appropriate treatments for these patients. In fact, ICI-MG or immune checkpoint inhibitor myasthenia gravis is quite severe with a very high mortality rate, and there are no approved treatments for the disease. And so studying the immune system of these patients can also give us insights about the best and more appropriate treatments for this specific subtype of patients.
That's so fascinating to me, to learn about the differences in that, the severity of the disease, as well as just speaking to the fact that it's not just the antibodies, that there's something else going on. It just goes to show you that this research is so critical and needed to understand the disease even further. So thank you for that. It's really just exciting work that you're doing. So as a patient, what's the most important thing that I should know when it comes to your research? How is this going to impact me, especially as someone living with generalized myasthenia gravis?
Yeah, that's a very good question. So I would say the very first important aspect is, and this is valid for all rare diseases, is to increase awareness of the disease. This is, very important for myasthenia gravis. And it's also important for immune checkpoint inhibitor-induced myasthenia gravis. And we would like to increase awareness among doctors and neurologists. And for example, as I mentioned before, in some cases, patients that receive ICI therapy develop muscle weakness, but they can also develop inflammation of the heart. So knowing that this disease is associated with inflammation of the heart is important because we have to look at the patient's heart and make sure that everything is okay. And then another important aspect that has important implications for myasthenia gravis patients in general is that there are cases in which these treatments are given to patients with myasthenia gravis to treat their cancer. And what we know is that in some cases, these patients can experience a worsening of their symptoms. So we know that this kind of treatment can also have an impact on the health of these patients. And because we know how these treatments work, this can give us insight on the mechanisms that can lead, for example, to myasthenia crisis or relapses, and how to target specific parts of the immune system to prevent these relapses.
That's wonderful. I think the more we know, the better we can be informed, and the better we can advocate for ourselves. Try to get a more personalized treatment plan, and just make sure that patient autonomy is intact too when we're discussing treatments and whatnot with our care provider. So that's great. And finally, what is the future of your research? I mean, this is a pretty monumental stride, I think, in MG research, to say the least. But what is the intended goal, or what does the future look like? What are your hopes when you conduct this research? What are you hoping to gain from it?
Well, we've published the results of our research, and we are working to confirm these findings in a larger group of patients. So this is actually quite important. And I've talked about an aspect of ICI-MG. There are so many questions to be answered. So, for example, as I said before, it's likely that these antibodies are not playing an important role in the disease. So there are maybe other factors that play a role in the disease and are responsible for muscle weakness in these patients. So we are investigating other factors that can contribute to muscle weakness in this specific subtype of patients. And then another important and outstanding question is that despite being quite severe, ICMG is unpredictable. We don't know which patients are at higher risk of developing this complication. And so it's really important to do research in order to understand if there are specific risk factors. And this is very important because, as I said at the very beginning, so this therapy can be quite effective in terms of extending the life of patients with cancer. But we also need to make sure that this therapy can be given to patients in a safe way. So I would say that predicting whether a patient will develop or not ICMG, it's one of our future goals for sure.
Yeah, speaking to that, when you're talking about, I think the same can be said for just, typical MG patients that are diagnosed. It's when you're trying to treat one thing in myasthenia and you get the side effects of another, it's this constant conundrum of trying to balance, how can we treat that specific problem without having these specific effects? So, and this takes it to a whole nother level. So, Dr. Masi, thank you so much for sharing your research and educating me and hopefully the rest of the community about this. This is such an important topic, and I hope that those who are interested can find out more and continue following your research. So thank you.
Thank you. It was very nice to talk to you. Thanks.
Thank you both so much for participating in this discussion, and thank you for your time. I think this is going to be a great resource for MG patients and their families. Thank you again so much for your time, and please stay tuned for the next episode.